My name is Chantel Frazier, and this is my Code of Ethics presentation. The healthcare professionals involved in this scenario are the case manager, the physical therapist, and occupational therapist. The ethical violations include beneficence, non-maleficence, autonomy, justice, and fidelity. I was at Health South, an inpatient rehab, and there was a gentleman named Bob that had been there longer than a typical stay at an inpatient facility since he was homeless. He had nowhere to be legally discharged to, so after a while, it seemed like the therapist didn't put much effort into his treatment sessions. In addition to that, his case manager had issues with finding a homeless shelter that would take him with the physical limitations that he had and the level of assistance that he required. But once she found one that would accept him, they didn't take into consideration how safe he would be there. And the rest of this presentation will go into further detail of how each principle was violated within this scenario. Beneficence is the concern for the well-being and safety of the client. Since this patient was at the point of needing to be discharged, it seems as if the therapists, both OTs and PTs, didn't put much effort into providing appropriate interventions for him. Most of his therapy sessions consisted of the moped bike or lifting light weights for most of the hour, with little to no supervision. That behavior does not support his well-being while at Health South or his safety without much supervision. Non-maleficence means to refrain from actions that cause harm for the patient. The therapist and case manager were ready to sign off on him being discharged to a homeless shelter that did not have his best interest in his ability to function and to be safe. Limited space for his wheelchair, limited assistance, and lowered beds, which would have impacted his ability to transfer. Not one therapist spoke up on this because they were ready for his discharge, but it took a student to go to the director of rehab with this concern. Justice is to promote fairness and objectivity in the provision of occupational therapy services. As stated before, as the other patients in the gym were receiving quality care, Bob was put on the moped bike, or he spent most of his hour lifting light weights each session. Autonomy is to respect the right of the individual to self-determination, privacy, confidentiality, and consent. The case manager violated HIPAA by explaining this whole case to me. I noticed Bob in the gym before for a while, but he wasn't on my caseload, so I didn't know in detail about his situation until I spent a day shadowing a case manager. This case manager didn't have him on her caseload either, but for some reason she felt the need to tell me everything about him and his case. Lastly, fidelity means to treat clients, colleagues, and other professionals with respect, fairness, discretion, and integrity. After spending the day with the case manager, I started to realize that the therapist would often talk about Bob in the office in a derogatory way since he had been there for so long. Not only did they talk bad about him, they would also make poor comments about the student that went to the director of rehab about his case. Another point of fidelity states to refrain from actions that reduce the public's trust in occupational therapy. In a facility with so many students, they should be careful with the example they are leading for the future of our profession, as well as how other professionals may view us. This is the end of my presentation. Thanks for watching.